Welcome to this Trans Advocacy Week webinar, Where Did the Money Go? How the COVID-19 crisis drains trans funding worldwide. My name is Julia Erd. I'm the Director of Programs of ILGA World, an organization that is one of the co-organizers or co-conveners of Trans Advocacy Week. Most of you, I assume, will know that usually in the Trans Advocacy Week, we convene trans activists to elevate trans issues at the Human Rights Council in the summer session each year. Of course, because of COVID-19, this has not been possible this year. So we are presenting a series of online events, which in this one is one of them. The Trans Advocacy Week is co-organized by GATE, Transgender Diversity, Sex Equality in Action, APTN, the Asian Pacific Transgender Network, Transgender Europe, TGU, RFSL, the Swedish LGBTI national umbrella organization, as well as ILGA World. And today in our webinar, we have 5 distinguished speakers whom I'll have a conversation with about, well, where did the money for trans funding go and about the impact of COVID-19 on funding for trans organizations worldwide. Among us is Mukasa, who is the program officer of the International Trans Fund. We have Cleo Kambugu, the director of programs at UHI. Rebecca Fox, senior program officer at Wellspring Philanthropic Fund. We have Justus Eisfeld, who is the advocacy and program development manager of sexual rights and diversity at HIVOS. And Victor Dinarski, a program officer at the Open Society Foundations. And before we go into the webinar as such, I want to encourage everyone, we have a Q&A session, to use the Q&A session. There will be time for a discussion at the end of the webinar. What we'll do is we'll have 3 rounds of questions from me as I will be moderating this event to our speakers. The first one will be around the work of our panelists in general. Then we'll dive into the impacts of COVID in the second round and have a look into the future in the third round. And then we'll end with a Q&A session. So if you have questions in between, please feel free to use the Q&A session already. We'll monitor what is coming in, and if it fits, we might answer question as we go along with the webinar. At this point, I'll thank our interpreter, Georgie, who is interpreting this webinar from English into Spanish and back. So for those who want to listen to this webinar in Spanish, there's an interpretation button down here where you can select the various languages, or well, various English and Spanish. So thank you for the interpretation, and thank you for Madeleine and Daniele, who support me with technical issues here in the background. Because anyone who's hosted a webinar knows that it's surprisingly, you're surprisingly busy, although most of the time the others speak. Thank you for that. And before we go into the substance, I want to briefly take a short pause, which we as well had when we were preparing this webinar, a pause to acknowledge that probably 5 years ago, a webinar that consists of trans speakers, or predominantly of trans speakers who work in grant making, would not have been possible, because at that time, trans people just did not work in grant making. And I want to acknowledge that in this webinar and at this moment, as you know, as a moment to acknowledge progress in trans organizing. And I want to take this opportunity as well to thank all the speakers here, because all of you had your take in that, as well as those speakers who cannot be here today, because we as well figured there's more trans people in philanthropy than just in this webinar. So I think that is already very, very good news. Although I am afraid that the substance of this webinar might not be good news only. And I do realize that we have lost one speaker. Anna, here she's back. So in any case, as I've said, we have 3 rounds. So let's kick off the first round. We'll start with Mukasa. Mukasa, you're the program officer, yes, of the International Trans Fund. Before as I said, we come to the impact of COVID. Could you maybe please explain a little bit what is your work at the ITF and what is it that the ITF, the International Trans Fund, seeks to achieve?
Thank you, Julia. It's such an honor to be on this panel. The program officer of the International Trans Fund, my name is Mukasa. Well, about the International Trans Fund, we are a global trans-led participatory grant-making fund. We exist to mobilize sustainable resources for strong trans-led movements and to eliminate funding gaps impacting trans groups across the globe. So we move money directly to small grassroots, often unregistered trans-led groups working on the front lines. Over the past 3 grant cycles, the ITF has disbursed $1.8 million to 75 trans-led 51 countries. We are now in our 4th grant cycle. It's just a little bit about the ITF. Thank you.
Oh, Mukasa, I think you broke off. Is there a way that you can move closer to your wireless connection?
Hello, can you hear me now?
Yeah, give it a try again.
Okay.
Please.
Sorry. The ITF is a global trans-led participatory grant-making fund. We exist to mobilize sustainable resources for strong trans-led movements and to eliminate funding gaps impacting trans groups across the globe. We move money directly to small grassroots, often unregistered trans-led groups working on the front line. Over the past 3 grant cycles, the ITF has disbursed $1.8 million to 75 trans-led groups in 51 countries. We are now in our 4th grant cycle and we'll be disbursing $800,000 this year. I just wanted to share just the brief update. I hope that was much clearer.
Oh, and Mukasa, could you speak a little bit about your role in the ITF?
Yes, I'm the program officer. I do a lot. Yeah, but I'm for the participants. I am here to support. So please reach out to us if you need anything.
All right. Thank you, Mukasa. I think they said they were supporting the grantees in their work at the ITF. Let's move on to Rebecca. Rebecca, Wellspring Philanthropic Fund is and has been a key donor for LGBT rights globally, actually for a long time, I think. Could you speak to our audience a little bit about, well, your work and what Wellspring's aims and goals are?
Sure. Good morning and good afternoon to people. At Wellspring, we fund on SOGIESC issues really around the globe, and I am honored to be the one person who works the most on trans and intersex issues, both in the US and globally. And I think what Wellspring, we really picture ourselves and try and be a movement funder. So that for us involves longer term investments, general operating support whenever possible, and also being there to support our grantees when they go through rough times and not thinking that's either their fault or something to be punished for. And the other piece I think that matters about Wellspring is that we also strive to be an intersectional funder. So for us, while we are definitely focused on issues around trans people, we're also talking about issues around economic justice, racial justice, and gender justice at the same time.
Thanks, Rebecca. Cleo, You're the director of programs at UHAI, which is an activist-led fund that supports work on sexual health and reproductive rights in East Africa. Could you explain to us and our audience how you work and whom you support?
Hi everyone, my name is Cleopatra Kambogu and I'm the Director of Programs of UHAI Issue. UHAI Issue is an indigenous activist that's based in Nairobi, and we work to support LGBTIQ and safe organizing in the 7 East African countries of Uganda, Kenya, Tanzania, Rwanda, Burundi, the DRC, and Ethiopia through providing flexible, accessible grants, capacity support, and supporting research and community on the continent through hosting the changing spaces, as well as other activists determine spaces. We have existed for 10 years, and in 10 years, we've been able to move up to 10 million US dollars in terms of grants, up to around 500 grants in the region, which we make in the indigenous language being Kiswahili and the other colonial languages, French and English. A key thing about our grant making is that we are a non-thematic, which means that we do not have any thematic areas that we have our link around. We advocate for multi-year general support kind of grants that allow community to innovate and determine what support would be useful for them. Our grant is by activists who make decisions on where the funding goes, because maybe the communities that do live that struggles need to do where the money needs to go, what change needs to happen. That's about all.
Thank you, Cleo. Then let's move to Victor, who's our next speaker. Victor, you're a program officer at OSF and working in the public health program. Could you give some context, please, to what OSF and the public health program in specifically is aiming to achieve?
Thank you, Yulia, and good evening, good afternoon, and good morning, everyone. I'll be happy to give you some background on OSF, which is the Open Society Foundations. Some of you who have been in touch with OSF know that it's a complex network of various foundations and various offices, and very often staff will collaborate on some grants, so we will co-fund different grants between different departments. I think what is important to underline is that OSF recently went through a sort of reprioritization of its goals, and now we have the 4 pillars of our work. We work on economic justice, defense against authoritarianism, and climate action and information democracy. And we are trying to move into a more diverse and also more inclusive grant making and also intersectional, which has been a lot of my focus in the past couple of months, to try to bring attention to trans and intersex needs across all these 4 pillars as I work on both trans and intersex issues. And specifically within the public health program, our current strategy, which ends in 2021, includes work around legal gender recognition, around ending violence in healthcare and violence, and recognizes also violence as a public health crisis. So we have grant making along the lines of improving access to healthcare for trans people, but also when ending violence, documenting violence. We work on the intersections of narrative change and community building and movement building as well. So we support organizations and try to give as flexible and general support as much as we can, and also support campaigning. That campaigning can be just around narrative change and visibility, but can also be linked to advocacy. So we have a wider range of work. And I think in terms of what is happening at the moment, and we will go back to it when we talk about the COVID-19 crisis specifically, but I think at the moment in the public health program, what we are trying to see is how to integrate trans and intersex funding as well into a more broader gender justice approach within not just the program, but also the entirety of the network.
All right, thank you. We might come back to that later. Thanks, Victor. So let's move to our last speaker, Justus. Justus, you work for HEVOS, and I think HEVOS is an intermediary based in the Netherlands. HEVOS supports LGBTI rights globally, among other things. Could you maybe explain first what an intermediary actually is, and then speak a little bit about how HIVOS works and what HIVOS aims are?
Thank you. And thank you for having me on this panel together with this great lineup of speakers. So in terms of foundations, there's generally two types of foundations. On the one side, there's private foundations, which are defined by getting their source of money from one single person or entity. So either a rich individual or family or a business that's the only source of income for this foundation. Open Society and Wellspring are two of those types of foundations. On the other hand, there's public foundations, which are foundations that themselves raise funds. Some of that money comes from individuals, and some of the money comes from larger donors who want to give money to a certain group of people, but have a hard time reaching them themselves. And especially for the latter, that's called an intermediary funder. In the case of HIVOS, it means that most of our income comes from governments, the Dutch government, the UK government, other governments, Swedish government, for example, who give HIVOS a relatively large chunk of money that we distribute to small community-based organizations. Because we've built connections with those organizations over the last 50 years since the inception of HIVOS, and over 20 years of supporting LGBTI groups around the world. HIVOS was one of the first public foundations to actually support LGBTI groups outside of Europe and outside of North America. And we're very proud of that, and that's a very important part of our work. HIVOS stands for Humanist Institute for Development Cooperation. That means we're a broad organization. We also work on green societies, climate justice, sustainable foods chains, etc. And on the other hand, open foundations, open societies, sorry, and part of that is government accountability, women's empowerment, and sexual rights and diversity. And in the latter, I am the Advocacy and Program Development Manager, which means that I get to develop all of our new programs and also fundraise for them. I have many colleagues who work more closely in the distribution of those funds to local organizations. Most of my colleagues work in regional or country offices, where actually the majority of HIVOS employees work.
Thank you, Justus. So after this round of introduction, when we've heard what our distinguished speakers are working on, let's move to the impact of COVID had on either your grant making as grant makers or on your grantees. And let's move, yes, let's do that. So the overall question for all of you, and I'm probably not going to repeat this all the time, is so what has been the impact of the pandemic and its mitigation measures on your work and on your work of the grantees, on the way how you do grants, so that you speak to that. And then I have one question for each of the panelists that is specific to their work. And I would ask you to do the overall question first, and then maybe move into the more specific one. And let's start to with Uhai. So Cleo, often trans community organizations have not been able to attract general multi-year operational grants, but most of the funding is then project funding. That has particular repercussions on how trans organizations suffered from the impact of COVID. Could you speak a little bit to that in your response to how COVID impacted trans communities, or in particular the trans communities you serve? Cleo.
Yeah, thank you so much, Julia. It's true. I think we need, still speaking to that, I think we need to unpack the question of capacity, how it has been used to sort of affect how much and what type of that about trans organizing's inability to absorb funding. And I think we need to separate between the requirements for work to happen and the requirements for organizing. And this is a good what obligation we onto our grantees that are really our requirements and other requirements for them to organize and do amazing work. And what our role is as a public foundation is to absorb as much of the options as possible and non-pass them onto our grantees and ensure that they are able to receive funding that's free of so many ring faces and so many obligations that make it difficult for them to be able to do their work. For that means being able to attract as much diverse funding as possible. We still do have to apply for project kind of funding and see how to still honor the many diverse needs that a community, that the cities in our region do have. As an Indigenous fund, that we need to do a regular scan of the organizing terrain where those are, so whatever we are finding speaks to those needs. But true, moving into the pandemic, even with our efforts around philanthropic advocacy and around ensuring that the funding we provide is systematic and has as little as possible and is close to being general support as possible, it became increasingly difficult for trans organizations in our region to be able to continue their work because they could not determine the content, choose funds when they did within the account. This funding was pegged to project support. And Philanthropy took some time to try to see how this funding could be opened up. And for us, that meant trying to see how to move alternative general support grants to more $300,000 US in making 68 grants across that support. But because philanthropic advocacy, we are also trying to see how we can connections with other philanthropy to see how they can be able to make such relaxations and how that could be done. But it's important to appreciate that not everyone is able to do that, and for them to see how they can rely on more Indigenous setups, intermediaries like ourselves, who have structures set up to do this kind of small grant making more to these groups and proximity. That's what's been happening. And one of the cornerstones of our advocacy during this cohort, because we have had some philanthropy with how do we support humanitarian needs when we haven't been set up for that kind of work. I think with philanthropy is that a general support grant, a humanitarian kind of support that's needed right now. So there's no need to reform yourself to humanitarian setup. Providing general support grants enables the ability to innovate and reform their programs through the pandemic as it goes through different iterations. Thank you.
Thank you, Cleo. And as people might have realized, in order to mitigate some connection limitations in the internet connection, we have shut down all our videos in order to improve the sound quality of this webinar. One of the multiple challenges I think that trans organizing on global scale is facing at the moment. So thank you, Cleo, for your account on the impact of COVID on the communities that you serve in East Africa. Let's move to OSF. And again, Victor, please, maybe you could start off with the impact of COVID on your work and possibly as well your grantees. My direct question, or my specific question to you is, OSF is one of the donors who has announced a specific COVID response grant of, I think, 130 million. Could you speak a little bit about that fund? How much of that is dedicated to trans work? And if you can, where does the money come from?
Thank you, Yulia. This is a great question. And I think before I actually answer it, I will like to give everyone here on this webinar a timeline of our response to COVID-19 to sort of bring the context in. When we first learned about the pandemic, programs individually, and as many of you know, but not obviously not everyone, programs at OSF have been historically very independent, including staff at OSF. So very often our grant making is based on budgets that we receive that we then disperse to grantees and either continued grantees or new organizations that come into our focus. When the pandemic first started, the public health program, and particularly my team, which is the sexual and reproductive health and rights team, has looked into possibilities of either give additional grants to grantees. We are, unlike some, for example, the ITF or other foundations, we were not able to bump up grants, so we weren't able to add money to existing grants, but we were able to bring more money to individuals and to organizations, which we have done. After this initial reaction to the pandemic, we have been asked by the leadership of OSF, which sits in the New York office and the DC office in the United States of America, to bring together ideas on how to have a more directed, more coordinated response. And through that, we were able to match different parts of our budgets and the programs to bring together grants for big organizations to re-grant to small organizations in order to bring about more money to certain movements, particularly also to the trans movement through intermediaries. And then we have had the 130 million fund, which I think contrary to what a lot of staff was hoping for, did not come from OSF resources. We were asked to contribute existing program budgets to this particular fund, which means that across all of different programs, a certain percentage has been dedicated to this fund, which then meant, and I know if there are grantees of OSF on this webinar, you most likely have been impacted by this. A number of grantees have seen their budgets reduced. It was an issue that a number of us as the staff have actually openly criticized and have asked for our leadership to look into the possibility of using resources, which unfortunately has not happened. And the 130 million fund has been largely invested in the United States. 37 of these $1 million have gone to New York City alone. It has gone to a number of various cities in the United States, and a smaller percentage has been given to other regions of the world. Also, I think, contrary to what usually our focus is, I think we tend to give a lot more in the global South than in the global North. So we have seen a big shift in our funding, and to be fair, also a shift in the way priorities are defined, particularly in this pandemic, because usually it would be a lot coming from the staff, and now it is the leadership that is driving the work. So also a number of organizations that were funded under this priority, under this fund, have been identified by our leadership. And I think it's important to underline that we are still in conversations with the leadership. We are trying to scramble additional funding. What I think is also important to add is that aside from just the general network response, there is also various different regional foundations have created their own COVID-19 related funds, which has also caused a lot of confusion with organizations that we usually support, because suddenly their usual renewal grants were smaller, but they were also given information that they can apply for a COVID-19 specific fund. So to be fair, from an insider point of view, from a program officer point of view, I think we did not give justice to this crisis. In the beginning, we were able to support our grantees with some additional flexibility. We also changed either waived reports or rescheduled them, or were able to send out payments a lot earlier than expected. That initial reaction, I think, gave justice to this crisis. Later, I think we were too much stuck in our internal processes. With regards to how this particular fund was available to trans organizing, I think it hasn't been as diverse and as intersectional as we expected. So we didn't even have a dedicated trans stream, which I think is really a shame, because we have known from our grantees and are still hearing the impact of that crisis. And, you know, like, we are members of the trans community. We see this also, you know, some of us are friends, some of us have been colleagues before. So we see this every day. And so for me, I really do hope that throughout the course of this, and, you know, as you know, the US has been severely impacted, but it doesn't mean that other regions of the world were not. And I think, I really hope that throughout this crisis, we will have a reevaluation of how much our funds were able to change the situation or to leverage the impact of the pandemic in the geographies that were chosen as priority, and that in the end, we will have a much better focus on regions outside of the United States, because I think it's a shame that we have neglected those geographies at this point.
Thank you, Victor, for being so transparent and upfront about the limitations of the OSF COVID-19 emergency response grant. Quite concerning, if you ask me. So thank you very much. Let's move to HEBOS. Justus, again, please give an account of how COVID impacts your organization's work. The question that I have for you specifically is, could you speak a little bit as well in regard to funding of trans organizations in the context of humanitarian aid and economic development? I think this is as well important because some of the funding that usually is going to trans organizations is historically or generically coming from human rights and not so much from humanitarian aid. So could you speak to that a little bit? And then possibly, if you can, give as well some account of what is, you know, happening to bilateral funding in Europe in the face of this crisis.
Only a tiny question, right?
Only quite, yeah, you have 2 minutes. No, go ahead.
Thank you. I mean, we can echo everything that the others have heard from their grantees. And one of the things that we heard loud and clearly, even before COVID hit, was that trans communities specifically are really impacted by everything that happens in economic development, everything that happens in terms of crises. It all gets amplified in trans communities. When unemployment rises, trans people are often the first people to get laid off. When COVID happened, trans sex workers were the first ones who were out of a job and got kicked out in the streets because they couldn't pay their rents anymore. And that, of course, has an impact on how our grantees need to also prioritize their work, because their communities are making demands and rightful demands on them that fall way out of any program description that they have sent to their donors a year, 2 years, 3 years ago. And that means that for our grantees, a lot of them have shifted their focus from the original programming to emergency response. And HEBOS has been able to support some of that work through funding that we raised from individuals in the Netherlands, often small donations that people send on a monthly basis. I believe that the big gap in funding for trans communities is actually in that realm, and I wanted to show you a little graphic first. So this is data from the OECD. They collect data on development and give some intelligence around who's, oops, I'm so sorry, that was not meant to, there we are. This big chunk here, that's all the official development aid, ODA. And this is in millions. So this is 208 billion US dollars that was given in official development aid in 2018 globally. Of that money, 75 billion went to social infrastructure, and somewhere here in the other social infrastructure and services, I'm assuming, is the funding that goes to LGBTI communities. Of those 5.5 billion US dollars that was given to other social infrastructure, around 40 million last year reached LGBTI communities. And an even smaller fraction of that reached trans groups in the global South and East. So this is a really small chunk of money out of a really small pot of money. But where we really should also be looking is this pot of money, economic infrastructure and services. 41 billion US dollars every year that goes to this, and currently so little reaches trans communities that it's completely negligible. The same goes for humanitarian aid, 27 billion last year. This year, this is going to be a lot higher because of COVID, because governments are giving a lot more humanitarian aid this year than they have in last year's. And a lot of that money is actually coming out of these pots: social infrastructure, health, you name it, it's going to humanitarian aid. And in humanitarian aid, even less is going to trans communities. And this is something that that HEVOS really wants to focus its attention on going forward, and it's something that we've switched our attention to over the past year or so, to really try and get a larger chunk of that money to go to trans communities. I visited some of our grantees last year, and one of our grantees in Kenya said, we can't create policy jobs for everybody. So creating jobs for trans people is a huge issue, and one that is difficult to fund through human rights funding, and should really be funded out of these economic infrastructure and economic recovery funding that we're seeing. So that's part of our mid and long-term COVID response, to focus on those funding streams and to try to channel some of that money to trans and intersex and LGBT communities. Did I answer all of your questions, Julia? And Julia, you're on mute.
Sorry. Yes, thank you again, Justus, for, in a certain way, confirming that it's only breadcrumbs that the LGBT community is getting, and the trans community then gets what's left from those in comparison. I will say you should stop sharing your screen. Mm-hmm. Here we go. Thank you.
And I'll share the link to this data in the Q&A so that people can look at this data if you're interested.
Thank you very much, Justus. So let's move to Mukasa, the ITF. Again, what's been the impact of COVID on the ITF and the grantees? And I think from the ITF perspective, it would be particularly of interest to hear about how the ITF grantees have been affected, because I do believe you've done some research into that. And if you could as well share some good practices from the International Trans Fund, that would be wonderful. Mukasa, it was yours.
Certainly. So COVID-19 has had a devastating impact across the globe. This evidence is that trans people are more likely than people to be immunocompromised, the underlying medical conditions, factors for developing more serious COVID-19 illness. Well, so we have received challenges from our grantee partners. I'll straight to a grant partner in Ecuador. The people dying without adequate care in their homes, and the few that have access to hospitals, that was a very big red flag. But I also will say that we conducted a survey, and the response rate was really high. From indicate that trans-led groups are highly impacted by COVID-19, deeply concerned with the pandemic. 97% of the grantee partners said if they were scared, extremely worried about COVID-19 at that time. And so for us, it was important for us to keep the groups as a participatory fund and with the ethos of being for us, without us. We went ahead to ask what the challenges were for trans groups. 73% said reported and related challenges for trans persons. Now that's a really, really important statistic. But I want to talk about the work that groups have been doing on the ground. Grantee partners shared with really impressive stories about how fast they jumped on to the situation, to care for trans persons, to care for their communities, but so the services, some of the that was just important counseling, giving out food and water, information resources, access to information on COVID-19 for trans persons is very results, and also groups giving emergency funding, which is something, as well as shelter and emergency housing. Yeah, so it would be interesting in that regard, but in terms of best, I can move right into the carried out meetings, one-on-one meetings. Our grantee partners, at least available. We offered direct support. We sent out emails for solidarity. But one thing we're really excited that we are able to do, or in the process of doing, is providing top-up grants for eligible grantee partners of $1,000 US. And on top of that, we supported groups at the time going into a final reporting period in adjusting their proposals, in adjusting their grants for humanitarian purposes. We've seen groups give out food. We've seen groups support communities with relief items and medical items. Take, for instance, trans sex workers. Trans sex workers were the most affected by the COVID-19 pandemic. But I also want to talk about healthcare, and particularly we got reports from grantee partners, an anonymous group in Kazakhstan and another group in Vietnam, about how difficult it is for trans persons to access hormones and surgeries at this time. Yeah, and I also thought it would be good in terms of recommendations to advocate for flexible and unrestricted going forward, whether it's via general support. We have seen how important that is for our groups and our grantee. Yeah, I think have I covered everything? Yes.
I think you did, and thanks for sharing the good practice from the International Trans Fund. I think it kind of confirms that the trans community does need a structure like the ITF very dearly. Thanks, Mukasa. Let's move to Rebecca. Rebecca, could you speak again as well a little bit about how COVID impacted Wellspring, how COVID has possibly shifted your work and your grant making? And if you can, could you as well speak a little bit about how COVID possibly has, impacted the whole funding landscape, if you can?
Sure. And, I appreciate the private, public, and intermediary funding, foundation, or an OSF. We don't have a humongous bank account that we pull from. Rather, our donors tell us annually what our budget looks like, because our budget's very much based kind of on the stock market, which frankly most large foundations are based on. And I'm telling you this because I think thinking 12 months in advance isn't long enough. I think that we're in for a period of 3 to 5 years of real fiscal instability coming from private foundations and then affecting public foundations. And that feels pretty scary to most of us. When COVID first hit, we have program officers who work on a variety of issues, and we came together and thought, what do we need to do to help our grantees right now? And a couple of things felt really clear. First of all was to not be cutting any grants. And this is not to do any kind of, what Victor's trying to do in OSF is incredibly difficult. With something that's a little bit luckier about Wellspring is that we're much less bureaucratic, we're a much smaller foundation, not in terms of dollars, but in terms of staff. There's only about 80 of us. So we gathered together and we were like, what do our grantees need right now? What are we hearing? And also, most of us are based in New York City, which was also undergoing the first real intense wave of COVID under a fascist government. So scrambling to figure out what our own lives were going to look like at the same time. And what quickly became apparent is that we needed to, and I really appreciated you bringing this up, Cleo, we needed to stop asking for such complicated reporting structures. We needed to send out emails reassuring our grantees that their grants weren't going to go down. And then we sent emails out to each of our existing grantees basically saying, what do you need right now? If you don't need anything, don't bother responding to this, right? Because there's always that pressure to respond to program officers. But if you do need extra funds, particularly we found for a lot of our grantees, because bilaterals really give that kind of project-specific support, which meant that there was a lot of pay on hold. If you do need something, please tell us how much you need and 2 to 3 lines about what that looked like. And that we have a mechanism internal to Wellspring in which we are able to increase an existing grant, not at a 6-figure USD level, but up to around $50,000. So we then very quickly, within the first month of COVID, moved out money to almost all of our existing trans and intersex grantees to do things like covering security costs, covering the cost of COVID tests and getting ill, going virtual for those who already weren't, and then frankly covering salary costs for folks whose grants were on hold or weren't getting their travel money reimbursed at that moment, just really trying to do a stopgap measure around what that looked like. The hope from the program staff is that things like having less reporting or having oral or video reporting is something that we will continue into the future. Obviously, having these really formal reporting requirements burdens the grantee much more. And also it's like not the best way to be learning about the work, right? That's happening in conversations, happening by building trust. And you all having to type out like 5 pages about objectives doesn't really do much for either of us. So really trying to push you who are Wellspring grantees on the phone who are like maybe freaking out a little bit about what the future is. In our conversation with our donors, they expected a minimum that will hold steady next year. We're not planning at this moment to do any reductions in grant making. If anything, we wouldn't be able to bring on new grantees, but we also wouldn't be decreasing our existing portfolio. So, and I've said this to all of my grantees, like of all the grant makers that you need to be worrying about right now, Wellspring luckily isn't one of them.
Wow, thank you. That was much more positive than I had anticipated it to be. And it sounds like that other grant makers, could benefit from some education from your end. So thanks, Rebecca, for sharing that. Let's then move into the future. As I said, we'll have 3 rounds. This is round 3. to look into the future, so what we expect to be happening in the next 12 months. And why don't we start with Justus? Justus, what are your thoughts around what's going to happen in the next 12 months? And if I can add a specific question for HIVOS, which I'm going to add as well to the ITF and to UHI. So what is it that you would need from the trans civil society in order to raise funds, again, from your donors for trans-led work? Justus.
Thank you. And you have to start my video because...
Oh, I have to start your video. I will do that.
You stopped it, so you have to start it again. Great. Yeah, thank you. So just as UHI and the ITF, HIVOS is relying on others to donate to us so that we can redistribute to communities. Most of HIVOS's money comes from bilateral donors to governments. And for a lot of governments, the official development aid, the big chunk of money that I showed you earlier, is linked to the GDP, the gross domestic product of that country. So it's a certain percentage of GDP that's reserved for official development assistance. And that's where the money for trans groups in the global South and East comes from. In all countries, there's movements from development organizations to lobby the government to freeze the ODA linking to the GMP and to freeze the budgets for official development assistance at the level that it was last year. So not to cut ODA, the official development assistance, as the overall income for governments goes down because of the economic recession. So, so that being said, some governments are more open to that than others for all kinds of other issues, for a lot of them, it's a very selfish decision. Their reasoning is if we can help stop COVID in other countries, it's not coming to us, which I think is a horrible reasoning, but if it works, we'll have to use it. Other countries are not quite as lenient, and we've already seen that a quite sizable project that we had planned for a long time with the UK government has been put on hold again, first due to Brexit and now due to COVID, and that's a project that should have been implemented months ago. And now they're even telling us we don't even know if it will happen at all. So so that's pretty devastating. The Dutch government has put organizations on alert that they may or may not keep budgets as they were. They may shift money from existing programs to the COVID response. And that means that we have to basically start all of our LGBTI fundraising lobbying all over again, because we have established relationships, and the same goes for other bilateral, for other intermediary donors like RFSL, like COC, Kaleidoscope Trust, that raise money from these governments. We have established connections to the human rights departments, but we don't have those established connections with the humanitarian aid departments. So we have to convince these people that they really have to go the extra step, the extra mile, to actually reach LGBTI communities and trans communities in particular, as well as intersex communities. So so that's really where our work is cut out for us. The other thing that I see in the future is that because budgeting and the programs that we run are often long-term, 3 to 5 years often, it means that the impact of COVID on our income is delayed. So current programs are less in danger than future programs. It may very well happen that current programs run out and then are not renewed with the excuse of COVID. So this is something that may or may not impact us for years to come.
Thank you, Justus, for that insight of what possibly could happen over the next months, and how COVID could, has a delayed impact on your grant making. Let's move to the International Trans Fund next. So Mukasa, what are your expectations, fears, assumptions on what the next 12 months? And again, same question for you as for Justus. Is there anything that you would need or hope from civil society to get in order to support your fundraising at the ITF for trans-led work?
Yes, thank you. So I think funding to trans groups was already a problem. It has become, it's actually now exacerbated. And I think that's something that important in terms of action points, how we can leverage or ensure that groups are supported, especially in difficult time and other crises to come, because the COVID-19 pandemic was really a wake-up call. We've really changed the way we work, and that those lessons should definitely be included in practice. I wanted to mention the fact that it's important to consult trans communities on what works for them and what they want. The results of partners need to pivot and respond to COVID-19. We asked groups to identify the urgent needs of the organization, and emergency funds was one of those needs that was projected. And I think for us, from our lessons to civil society, but also as we to work with them and hear from them, is for to incorporate security in their budgets, to collaborate on emotional resilience strategies and advocate for contingency development. For instance, Grantee Partner Youth Initiative Uganda that has drop-in centers. At this time, COVID-19 pandemic, when the COVID-19 pandemic happened, they did a considerable amount of work in supporting trans sex workers because of how they're structured. So it's small things that be developed into a broader cause in advocating for financial support to trans communities. And I also had somebody mention capacity building.
Are you still there, Mukasa? I think you cut off, or were you finished?
Oh, yes. Thank you.
All right. Thank you, Mukasa, for that account. Let's stay with the community-driven grants, and I'll ask Cleo of her account of what's going to happen the next months in the future. And I will add the first question that we've got in the Q&A section, and that is as well an encouragement to all people who are listening in to us today to put your question into the Q&A section as we're approaching the time to answer questions. So we have a question from Queen and Russell, who is actually encouraging Cleo to talk more about a policy issue, namely how COVID-19 has been instrumentalized to further the agenda of the anti-gender movement. Cleo, could you maybe weave this into your response?
Yes, thank you so much. And I could start with what we need from our grantees right now. For the next month, we're doing a research to document the impact of COVID-19 on the communities that we support in, and that would inform how we continue reforming our programs to be able to respond more effectively to the community needs as they evolve, but also use it for our philanthropic advocacy. I think COVID-19 the pandemic itself was an opportunity for us to boot the movement and the species, because I wouldn't want to romanticize the old normal like it was something amazing. What's important right now for the next couple of months for philanthropy is to ensure that civil society does have the funding that they do need to be part of the very many components, builders that will be present in rebuilding the new normals. And just to weave that into the anti-gender ideology and how governments have weaponized COVID-19. Even prior to the pandemic, there's been a pre-existing shift in governments to the right wing and a growing anti-gender movement. What we're seeing during this pandemic is that we are seeing a couple of actors and governments using COVID-19 as a way to undo the very many gains done by governments globally, part of them being not considering trans-specific health services and broader SRHR service as essential in our region. Because our communities are criminalized, they often do set aside community centers through which they can access health support. Those weren't considered. Governments put up lockdown measures that to prevent the spread of COVID, social distancing. And what did this mean for the communities in our region? We do trans folk in the region who can't stay with families because they are transphobic, or can't afford their own homes. And we've had governments raid safe houses for our community members and speak to their inability to social distance and their negligence in continuing to spread that disease. So these are some of the ways in which this has happened. As a public foundation, because part of the funding that we do attract is from bilaterals, several governments, overwhelmed by COVID response for their own citizens, are rethinking their foreign policy. And what we are thinking about is what that means for the funding that we've been able to attract from bilaterals coming to our movement. It's still restricted, but it still does three things around advocacy, and how those things will be sustained over the next couple of months. I think there is an opportunity for us to seize here, where we've seen different philanthropy establish COVID-19 funds specific to COVID-19. I don't think those funds, those small funds would go through, but I think they would help philanthropy rethink through how differently they could do funding to our communities, to the trans communities globally. And that includes a shift that's happened around a movement towards less project specific to more general support that's multi-year, that's more flexible. I've seen a couple of funders moving towards that direction, and my prayer is that this is the direction we keep as a sector, moving towards that direction, just to be able to allow trans organizing and really broader LGBTI organizing to check the different government measures that they are putting in place, that they are human rights sensitive and they're inclusive of minority populations. Because the problem we are having in our region is not the government inaction or action, is the lack of engagement of civil society in this space, and how COVID-19 has been used to further shrink the civic space and civic participation. So both opportunities and fears, but for me, mostly opportunities that remain, that if we plan better, they could be seized.
Thank you. Thank you, Cleo. And thanks for reminding us that the old normal was already quite shitty from a trans organization point of view, at least if it comes to money, and as well to allude to the importance of civil society interaction. Rebecca, I suppose in Wellspring, you don't have to make the external case for money. I want to add to the question on what's going to be in for trans grant making in the future, whether there is something that you would need or welcome from trans civil society in order to make your internal case for trans funding.
I think for us, always hearing what's happening on the ground, and particularly what everyone else has been saying, how other funders may be pulling money, how that impacts our grantees and the groups that they work with is really key. One of the other things that's pretty helpful, and I don't know if people always realize this, but grant makers also have like our organizing groups, right? Like a TGU or APTN, there's something called the Global Philanthropy Project. And they put out reports every year about what the state of funding looks like for LGBTI funding, with a pullout. I really want to encourage people to just take a minute and Google that Global Philanthropy report, and then it's called Global Resources. And what that report shows us, 2017 to 2018, is that about $28 million of, which is about 11% of all LGBTI funding, went to trans groups. And $28 million may seem large, certainly more money than any of us will. But it is not, it's a drop in the bucket when you think about the need a really small amount of money. I think another thing that you're hearing on is called the AI funders. And really, having been in philanthropy for 8 years now, having done fundraising for a small NGO before this, I think the most important way that trans groups can grow is actually growing outside of LGBTI funding, and to start looking at places like women's rights funding, particularly those who say we do gender rights, but we know that oftentimes that just means, thanks, Eustace. Eustace just put in the chat box a link to the report that I'm talking about, and page 45 is where you'll find funding by gender identity. So really it's women's rights funders a lot of times, or development funders, where that's where I actually think the most growth is going to come from around trans funding. Those are sources that frankly are much larger overall, but also, you know, a lot of them say we fund gender justice when they just mean cis women, right? So part of what we need to be doing is pushing them to say, when you say gender, are you just trying to use the popular word? Are you actually trying to have an inclusive definition of what gender looks like? And something that's always, that we're always here to help with is if you're thinking about applying to a group, a foundation, and you're like, this looks like we would fit, but have they ever done this before? Have they ever funded trans groups? Are there things that we know about there? Are they pro-sex work? I'm always here for that conversation. So if I don't know the answer, which I probably won't, I can always turn to my colleagues and friends and just ask that question. But really, I think it is around looking at what are our other options. And one of the big women's rights funders groups that comes together is called POWR, PAWHR. And that really has the largest amount of women's rights funders who are progressive women's rights funders. So most of them do have grantees that are trans-led, and I would definitely also be looking in that space. And the last thing I'll say about the report is it lists out who all the funders are. So really just take us information. It tells you by region. And I also want to suggest, you know, philanthropy exists to uphold capitalism and is really functions under capitalism.
I'm sorry, we have lost Rebecca. Let's see whether we can bring her on. Again, she seems to have challenges with her internet connection. So we'll catch up at the capitalist sentence, I suppose, and move to Victor in the meantime. We'll bring Rebecca back after Victor has spoken. So Victor.
Rebecca seems to be back, so you may
Rebecca's
want to...
back. Rebecca, are you back? You were cutting out quite some time.
Sorry, yeah, Brooklyn, where Victor and I both live, is not set up for people to be working from home in the way that we are. So our internet has also gotten pretty shoddy. So what I was saying, and I'll try to say it a little faster, is that the way that capitalism shows up in philanthropy is to be, well, hoarding of wealth, obviously, but also the way that groups are pitted against each other for funding. And I really think groups saying, actually, we work in coalition. We're not willing to work against each other. We're willing to work together. We want to be working together, so joint programs, but also sharing donor lists, which I know can feel really tricky, but saying this is who funds us. Have you thought about reaching out to them for funding as well? Have you thought about talking to them? And when one of my grantees is like, there's this other group that you should talk to who's doing amazing work in our region, that to me shows that that grantee is really sure of what they're bringing to the table. And are really truly working in partnership. So thinking about how to organize that kind of pushback, I think, is really important. And thank you all for the patience with my internet.
Well, and thank you for that important piece and raising again the collaboration, solidarity, and the relevance of that, as well as, I have to say, the women's rights funding that I suppose needs to be moving away from women only to a broad understanding of gender. So thank you for that, Rebecca. So then, Victor, you are the last in round 3, and here again an encouragement to the attendees in this webinar to, if you have questions, now would be the time to put them in the Q&A while Victor is speaking. Victor, impact of COVID in the next 12 months, and as well, it sounded like you could do well with some support in making the internal case when you were reporting about OSF's COVID response earlier. So feel free to elaborate on your wish list.
Thank you, I appreciate that. And I know I gave a bit of a grim picture of what's happening, but at the same time, I also wanted to say that in the conversations that we're having right now about my program strategy, the public health program, I think we're getting into a more inclusive and sort of collaborative look at trans rights. I think my biggest problem as a program officer thus far was the fact that I am sort of seen as the trans rights program officer. So very often, I'm either expected to fund everything that comes into my colleagues' attention that is linked to trans rights, and budgets are limited and we have continued grantees in that particular budget. And also there seems to be a lack of information on trans issues specifically, or how to fund trans rights or how to be a trans inclusive funder within the network. So it's not just my job, but there's a colleague on this call who is participating, Luke Athaide-Rizaro, who is part of our learning and grant making team for all the network. And we have actually collaborated together on trying to bring a more trans inclusive lens to the work of OSF. So we are hoping that we will be able to create trainings internally for staff to not only understand trans issues in general and how to be a good ally to trans people, but also how to include that into grant making practice. And I have actually been pretty great at bringing in the women's rights program as well. I think my colleagues have been very receptive as well, very open into not just seeing trans specific needs in terms of women's rights funding, but also seeing how to be trans inclusive in existing work. So we have done a lot of sort of bridging in that regard. And in terms of I think we still have a long way to go. I think we still need to work on reaching out to the most senior of our leadership. We are also working with a group called Funders for LGBTQ Issues, which is based in the United States, and it's United States focused, but because of the fact that our leadership sits in the United States, it is easy to get them on board as well. And we are trying to set up a series of trainings with them. And there's also an initiative that exists in the philanthropy world called the Grantmakers United for Trans Communities. It is a group that offers scholarships and opportunities for trans people who are in philanthropy. And there, in that particular space, there is also the pledge that sort of invites philanthropic organizations to be more trans inclusive in their grant making, as well as to bring more trans people on their staff. And we are now actually internally advocating to have this signed with our leadership and to bring it together into our grant making practice. In terms of the civil society, I think everyone is doing a great job in terms of making a case as to why trans people need to be included in the COVID-19 response. I know there are surveys going on. I'm in touch with regional organizations who are working on it. And I think what I specifically would need is just for you to email me if you have any resources around this particular issue, and also if you have any findings around what we sometimes call the new normal that the world is sort of coming into. I think just sharing information is enough. I don't think it's particularly good practice to ask for much more work that you are doing, because you are all doing incredibly well and trying to keep not just yourselves, but also our communities afloat. And I think that's extremely valuable and important. I think what we need to do more actually internally is to advocate more for the recognition of the fact that this might be civil society going forward. This might be that we may not be focused on advocacy as it used to be, traditional advocacy. We might actually shift into more humanitarian, more keeping communities afloat kind of approach. And I think we're having these conversations right now internally. I just hope that we will have them for a more trans inclusive lens. But to be fair, there are also a lot of colleagues at OSF who are very receptive towards needs of trans communities. And we are actually looking into linking trans work in the overall gender frame, connecting to Cleo's point about anti-gender movements. I think we are able right now to see that it's not just trans people affected or LGBT people. The anti-gender movement is obviously a lot more broader, but it also connects to the anti-vaccine movement. It connects to the disinformation around COVID-19, which is a particular problem in the United States specifically. I mean, a lot of you probably saw the new civil rights era of anti-mask movement, mostly led by white people, while the Black Lives Matter movement is extremely strong and actually trying to bring about more racial justice into conversations in the United States. So we are trying to also connect this into a racial justice framework as well, but particularly I think the public health component is very interesting and also very important, because you can connect to an anti-vaccine movement, you can connect the anti-gender movement, and we also have a very targeted disinformation campaign around the WHO, which again, led by the United States. I think we will be looking at the United States as sort of like the source of the worst for years to come. And we're trying to see whether we can make a much more inclusive but also much more compelling global case for trans rights, seeing that in many geographies and localities, trans people would be the first scapegoats of authoritarian governments. So it connects to our overall goal on authoritarianism, but also shows that trans people are extremely vulnerable right now as a community, and we cannot just take money away from those communities. We need to actually make them stronger, ensure that activists that we support, but also the communities that they work with, survive through the worst that is, I think, still yet to come. I think we will be dealing with this crisis for a longer time, and to ensure that we also don't lose the wins that we, as OSF, have supported for the last 15 years. I think we are one of the biggest LGBTI funders still in the world, and I really would like us to not lose that focus and to ensure that trans rights are seen as important part of the work.
Thank you, Victor, as well for being transparent about what happens in OSF and how you connect your work to the work of other movements, and as well to try to hold ground in our our successes in the past, or OSF successes in that case in the past. So we're coming to the Q&A part. So again, an encouragement to send us your question. We've received one question from Jessica Marianne Franco in Spanish. So I am using an online system to translate because some of the limitations of this moderator is that I don't speak Spanish. So Jessica writes that the cis-sexist system does not provide equal access to tools to fill out funding applications. She asks about whether there are platforms or tools that have information that will help trans organizations to fill out applications, and whether there is information in kind of real time for funds available that people in this call among the panelists would recommend to follow in terms of the social networks. And she sends greetings from Mexico. I have a feeling that some of those resources could be found in the report from the Global Philanthropy Project that was already shared in the chat, at least when it comes to funds available. Who in the panel would like to respond to either add to that one and to the support in filling out funding applications?
I can
yes, please, Rebecca.
And first, I would actually say to talk to the program officer for the foundation that you're working with. If questions are particularly cis-sexist or transphobic, they should actually know that. And you don't have to be like, there's ways of being like, this form just doesn't actually work for our community. Can we talk about how to make that happen? I also think, and I recognize that not everyone has this, but if there are larger NGOs in your region, talking to their development officers around how they've done that work, and if there's groups like TGU or APTN, asking them to hold sessions around literally how to fill out grant forms, because they are tricky and they cause so much stress. And once you know the tricks, are much easier. So really using those human resources to get there.
I think you can keep your video on, Rebecca. The next question from Christian Scully is as well for you. I think Christian wants to know about what you believe are the main barriers for facilitating more partnerships across organizations, and in regard to sharing donor lists, as you've mentioned, I think in your intervention earlier.
I think there's actually a lot of mistrust among groups in some regions, in some places. And I think a lot of times that really, it does come out of capitalism and colonialism too, of pitting people against each other. And that sometimes the conversations that need to happen are things like a very honest of, we haven't always worked together well, we haven't always trusted each other, and how can we fix that, and starting from there. And it is important to agree with a strategy without making that personal. So to say like that, we're more of a grassroots groups, they're more of trying to change legal policy, and that both of those are valid ways forward versus disparaging one or the other. And the last thing I'll say is that inter-movement fighting does nothing.
There's a disconnect again between Brooklyn and the rest of the world. Maybe we can come back to your last sentence at the end. We have one other question from Mona Lisa, who would like to know how the panelists or the panelist organizations support grassroots organizations in particular to tackle issues affecting trans women, because most grassroots organizations are not, don't have the capacity in terms of using virtual spaces for interaction. So how can we support those grassroots organizations? Who wants to answer that one from the panelists? Mukasa, do you want to maybe jump in here?
Sure.
Go ahead, Mukasa.
Yeah, I think this is a really good question going into the future. I would think perhaps online trainings on how to use digital tools. Like we just trained our GMP on platforms, use of platforms, and we had a successful grant award. So I think there's potential, there's opportunity for partnerships to happen for the grassroots groups that require these skills. But then again, I just want to reiterate that it's important that comes from the groups. Yes, so it is a work in progress, yeah.
Thank you, Mukasa. And there's no more questions in the Q&A section, which I suggest that we'll wrap up. I mean, we started roughly 90 minutes ago, and I was saying that we would not go over the 90 minutes, so it seems it's time to wrap up. Let me do that by again reading out what Rebecca was saying, but we couldn't hear it because of the Brooklyn rest of the world disconnect. She wanted to end on, the enemy is our opposition, not each other. And we need to remember that and hold each other gently. And I think that's a fantastic sentence to retweet, but as well to end this webinar on funding. And I'll thank all the speakers for their contributions to the webinar. I'll thank again, in particular, Georgina, for the interpretation of this webinar to make it accessible to a larger group of people. We'll make the webinar afterwards available on YouTube. And we'll have another webinar next week in the context of the Trans Advocacy Week on the impact of COVID to our movements. So not so much on funding, but on movement in general. So stay tuned on that channel. And I'll wish you all a good morning, afternoon, evening, or night, depending from where you've tuned in. And yeah, have a good, rest of the day or weekend, if that is already approaching for you. Thanks a lot, and bye-bye.